There is a nationwide effort to lower the number of COVID-19 cases, slow the spread. Dr. Anthony Fauci has been helping to lead that response as part of the White House Coronavirus Task Force. He's also the director of the National Institute of Allergy and Infectious Diseases with the National Institutes of Health, and he joins us now. Good morning, sir.
Good morning.
We're so glad to have you here. A couple of questions. Naturally, a lot of people very concerned about the possibility of a vaccine of some sort for this, but you've cautioned that we can't expect 100% effectiveness at this. What do you expect when we finally see a vaccine hit the market?
Well, you know, vaccines are very rarely 100% effective. In fact, I don't know of any that are 100% effective. We would accept a vaccine that's 50 to 60% effective, but I'm hoping that we're going to do much better than that, approaching 70, 75. It's very difficult to predict until you've adequately tested the vaccine for safety and efficacy, which is actually going on right now as we speak with at least 2 and soon 3 candidates in the United States. And as we get into the late summer and early fall, an additional 2 or 3 candidates. So there are a number of candidates that are being tested, and we hope that more than one of them will be effective enough and safe enough that we could distribute it widely by the time we get either to the end of this calendar year or as we enter into 2021. So we're cautiously optimistic about it, but you've got to test it first to make sure that it's safe and to make sure that it works.
Here in North Carolina, we've got a lot of kids going back to school starting next week and the weeks to follow, many of them staying at home, some actually going back into classrooms, depending on the location. You've said it's important to reopen schools or at least get kids back to learning, though. But what do you think about kids in the classroom?
Well, you know, it really depends on, and that's a great question because there's a lot of confusion about that. It depends on the level of infection in your community at the time. I mean, if you're in a green zone where there's very little infection, and you have less than 5% positivity, that you can probably open the schools with really virtual impunity as long as you take some reasonable minor precautions. When you're in a situation like North Carolina is, where you're just teetering right at the level of the yellow zone, the best thing you can do is to try and get the level of infection down in the community, but make sure that as you open the schools, the paramount consideration is the safety and the welfare and the health of the children and of the teachers and the secondary effects on the family. So if there's infection in the community, you might want to do things like physical distancing, wearing masks, you know, doing some classes outdoors when the weather allows you to do that, and washing hands, giving the children the possibility and the accessibility of being able to frequently wash hands. Those are the kind of things you do. When you get into the red zone, which North Carolina is not, if you're getting into the red zone, then you really have to seriously consider whether you want to get children back to school given the circumstances that you're in. The best way that communities can get children back to school is get yourself into a green zone when you're dealing about the number of infections and the percent positivity. North Carolina is almost there. They're right at the edge. Last time I looked, I think they were like 6% positivity, which is right at the edge of that. So you're doing pretty well, but you need to be careful when you bring those children back.
What are your concerns going into the months ahead? Naturally, with winter, we've got not only cold and flu season, which tends to escalate then, but we've also got more people in tighter spaces. Are you concerned that we're going to go backwards on the progress we've made so far?
Yeah. You know, if we do not do the things that are highly recommended by myself and my colleagues, we could be in trouble. But if we do it uniformly, and those are 5 fundamental things with maybe one extra 6th one, and that's universal wearing of masks, physical distancing, at least 6 feet, maybe more, avoiding crowds, do things outdoors, preferably over indoors, and wash your hands as frequently as you can. The 6th thing is things like that we know are the hot spots, either staying away from or closing bars. If we do that as we enter into the fall and the winter, we could turn around the surges that we're seeing in certain counties and states, particularly some of the southern states, Florida, Texas, California, Arizona, Georgia, and those places. Many of them are turning around right now. But we're at a baseline that's quite high. I mean, if you look at the number of infections per day in the country, not necessarily in North Carolina, but in the country, it has gone from 20,000 a day up to 70,000. Now it's down to around 40 or 50,000. That's still way too high to enter into a season where you're going to have more people indoors and more people congregating in a place where you don't have good flow of air. So we've got to get that level down. If we do, it will be much safer and much easier to go into the fall and into the winter at the same time as we're opening up the country from an economy standpoint, from an employment standpoint. I believe we can do it.
Dr. Fauci, one last question. What would you tell parents who are concerned about their kids? They're concerned about kids either going back to class or starting to interact more with their friends, and we hear numbers about what could happen in the months ahead. What do you tell their parents about how to keep their children safe and how to sleep a little better at night?
Well, that's a combination of what they can do at home and what is done at school. I mean, it's up to the authorities in the school, the teachers and others, depending upon where you are. As I mentioned, if you're in a county that really has very little infection, you can be okay. You can do things, simple things, wearing a mask, avoiding, crowds and things like that. But if you're in a hot zone, I think it's going to be up to the parent to make up their mind about the risk. The school should be able to mitigate those risks. The CDC has some very clear guidelines of how you can lessen the likelihood of getting infected and what you should do if, in fact, a child gets infected. So I would encourage parents and teachers to read the CDC guidelines and to look at where you are in a county vis-a-vis the numbers of infections that you're having locally. That will influence what you do.
Dr. Anthony Fauci, we appreciate your time. We appreciate your expertise. Thanks very much.
Good to be with you. Thank you for having me.